Um, I welcome Dr. Patricia Johnson, a hearing specialist, to the ICA Health and Wellness podcast episode. Patricia, thank you very much for accepting the invitation.
Yeah, thank you.
Um, Before we get into the meat, I'd like to introduce you to the audience. Dr. Johnson is an associate professor in the University of North Carolina School of Medicine. She practices as a clinical audiologist in Chapel Hill, providing aural diagnostic, tinnitus, and aural rehabilitative services. As part of one of the nation's highest ranked Doctor of Audiology programs, Dr. Johnson teaches several graduate courses on hearing aid technology and occupational audiology. When not seeing patients and teaching, she is committed to interprofessional education and community outreach. Dr. Johnson is certified by the American Board of Audiology, holding their certificate for Tinnitus Management. And Dr. Johnson also serves on the executive board of the North Carolina Audiology Association and in several leadership roles with the American Academy of Audiology.
Thank
That's
you.
that's a lot of experience under your belt.
I appreciate it.
So we'll be talking to musicians in this episode with you, and I believe you have some connection to music.
Yeah, music has always been a part of my life. I'm one of 6 kids, and we were all very musical growing up. My mother was a piano teacher, so we all played, we all sang. At Christmas, we did 4-part harmony Christmas caroling door to door, and I grew up playing several instruments myself, and continue to sing. And I had shared earlier, I wanted to be a music teacher. That was always my goal through elementary, middle, and high school was the intent to be a music teacher. Unfortunately, didn't
Nice.
quite work out. I auditioned on saxophone, and they more or less said, "Well, you need a little more practice. Why don't you try again next year?" And I was not accepted into the School of Music that I auditioned for. And it's interesting how it worked out because I was waiting to take or to register for those music courses as a freshman in college, and when I was rejected, I all those classes that are typically taken by freshmen were already filled, so I took sophomore level classes instead, and one of them was Intro to Communication Disorders, and I fell in love immediately, a secondary love. So the good news is that music never leaves you. There's so many avenues to continue to be part of music, and it just wasn't meant to be in that capacity. And I got to be a teacher anyway, so ha ha ha.
That's funny. I mean, audiology and music they are intricately related. So I bet you have a lot of experience still with music or musical people, musicians, people doing anything with music. Um, so my next question would be a very general. How do we hear as humans?
I love this question because it's endlessly fascinating, and hearing is nothing short of miraculous that any of us actually hear at all, because so many sequence of events have to happen exactly correctly in order for us to perceive sound. And at any point, if there's disruption to that sequence, it's a hearing loss. It's going to impact the individual. And so part of my work is to determine where along the pathway is it occurring so that I can treat my patient correctly. So we start with just sound in the air as pressure waves collected into the ear canal, assuming there's not a big blob of earwax that gets through the eardrum, this membrane that collects the sound and vibrates on its own. There's these tiny bones behind the eardrum, the smallest bones of the body, rock back and forth, and now the sound has turned into a mechanical displacement. It in turn is connected to this snail shell bony labyrinth inside of our head called the cochlea. It's filled with fluid, and now it becomes fluid dynamics. So inside of the cochlea are these microscopic hair fibers, almost like seaweed of the ocean. And as the water is sloshed and pushed and pulled, they get excited about it. And so when they fire, they then send that information on through the auditory nerve up to the auditory cortex for interpretation. So just a whole complex series of
That
events.
is.
And I want to focus on the cochlea because if we roll out the cochlea, it's a piano. It literally is designed as a piano inside of our ears, which is just amazing, where one end of it is tuned to high treble tones, and in perfect tonotopicity, it goes down to low bass tones. And depending like which hair fibers are triggered, we perceive pitch. So it's really just amazing.
That is very interesting. I didn't know about that. The different kinds of hair fibers, they translate different frequencies within.
Absolutely. And then even part of our auditory cortex, which is a pretty sizable part of our brain, is the interpretation of sound. It has tonotopicity too, where certain parts of the cortex are for high frequencies and some are low frequencies. So clearly, through human evolution, this pitches mean different things, and pitch as it contributes to language, and certainly pitch as it contributes to music, is really important.
See. So my next follow-up question would have been, why is this channeling of different frequencies? Is it because the brain recognizes or deals or yeah, recognizes auditory feedback or auditory stimuli differently based on what it is, like music or speech or anything, a low rumbling?
Yeah, when we think about animal models, they're trying not to be eaten, so they are going to have their auditory systems adapted to being able to hear predators, but also communication. And birdsong is a great example of that. The complex nature of the music that they produce carries meaning of watch out, here comes a hawk, or I'm over here and I'm looking for a mate. And obviously humans are using complex speech sounds in far more complicated ways. But we could talk about the phonetics of speech quite a bit as well. But low frequency vowels, high frequency consonants, they carry quite a bit of different information.
Absolutely, very nice. I know that a number of years ago I had a bird singing recorded and slowed down to, I believe, 280 times in times, and
Okay.
it was
Yeah.
perfect harmony, perfect melody that came out that seemed like just chirping. So it was quite interesting how much information goes into a second of auditory stimuli.
There's a lot
Um,
of similarities in the treatment I provide for bird watchers that I do for musicians.
wow, okay,
Yeah.
nice. Um, so musicians are exposed to different kinds of music and auditory levels throughout their profession or their education, whether it's chamber music, a personal practice in a small room that might reflect sound quite well off the wall, or any large orchestras that people might be sitting in front of brass players or in the middle of the orchestra where they have a lot of auditory feedback. So musicians are exposed to kind of a hearing loss. Um, how are musicians to understand noise-induced hearing loss and risks when they either students learning or practicing or professionals as performing?
Yeah, I'm so glad that you also made some distinction between the acoustic space really does matter. Is this an amplified room? Is what instrument is behind me? All of those things really do matter. But as a profession, musicians are at significantly greater risk for noise-induced hearing loss. And we easily think of professions like policemen and soldiers who are going to be exposed to occupational noise, and we kind of forget about musicians, partly because what you're doing is so pleasurable, and it's hard to think that anything that is enjoyable could be harmful to me. But at the end of the day, repeated exposure to really high level noise has the potential to harm any of us, and some of us are at greater risk. And so it's it's about how loud, how long, and the repeated exposure. So going back to those little hair fibers, the seaweed in the ocean that fire and send the sound, in order for them to fire, like any neuron does, there's a release of chemicals within their bodies to fire an action potential. Noise-induced hearing loss is too much of a good thing. So you basically have over-release, overstimulation of those chemicals, and instead of it being good, it becomes toxic. And so noise-induced hearing loss is kind of like internal toxicity of these chemicals. With acoustic rest, we hope that the cells can reabsorb those flood of chemicals. The little hair fibers literally keel over, and we hope that they come back up again. But with repeated exposure, they don't. They stay down. And we have a finite number of these hair fibers. Unless you're a bird or a frog, they can regrow their hair fibers spontaneously, but humans cannot. So, one of the questions you had sent me was asking about temporary threshold shifts. So,
Yeah.
temporary threshold shift is basically a hopefully temporary reduction of your hearing, and that we've all experienced it from time to time. Maybe yourself have just been a concert goer or attended a loud Fourth of July fireworks show or something, and you go home and you're like, it kind of feels like there's cotton in my ear, things are a little bit muffled, and then the presence of ringing, of some kind of tinnitus that is, kind of there, and you're like, what is that? And by the next morning, your hearing's back, the tinnitus has gone away, and we don't really think about it. But if that keeps happening, that is the warning sign. The damage is being done. You just hope that it wasn't so bad that the auditory system can't recover. But if we keep doing it, we don't come back to full baseline again. And
Okay.
analogy I'll use is a sunburn. We can have a pretty, several really good sunburns in our life, and the skin, our cells in our skin will heal. But if we keep doing it, at some point the cell functionally changes, and it can be a real problem. And that's hearing too.
Okay, interesting. So, what happens exactly when we experience hearing loss? Is it only the killing over of those hair fibers, or there's more to physiologically?
That's going to be the most common type of hearing loss, is at the level of the hair fibers. We call that sensory neural hearing loss. There are certainly other types that are impacting the eardrum, that are impacting the bones that were in there where they're getting stuck. Those are mechanical, or what we call conductive hearing loss, that have surgical management and treatment, but that's only about 15% of hearing loss. Everybody else can more or less assume, and I help them determine this, that the hearing loss is coming from the cochlea, it's coming from this nerve fibers. And other risk factors are going to be your family history. There's certain illnesses, certain medications that are also harmful to these hair fibers, but noise is the big one. And it's innocuous. It happens so slowly, usually, very, very gradually over time from a lifetime of exposures, that we don't know that it's occurring.
So, as you said, when anybody or musicians hear that tinnitus, that sine waves, that means that they are experiencing some hearing loss, whether temporary or permanent.
Well, I want to be careful about that. Both hearing loss and tinnitus are symptoms. They don't
Okay.
cause each other. They are both side effects of hair fibers in distress. So, certainly a significant number of people have both, but you can have one and not the other.
Okay. And another question based on what you said. So this chemical toxicity that you mentioned, there might be too much and an overload in the body. If can it be reversed, or is there a point that is irreversible in the hearing?
Yeah, most temporary threshold shifts are going to recover, but it all adds up over time, which is why musicians are at such great risk, is because you're the ones practicing hours, you're the ones in these long rehearsals, you're being exposed. Me just coming as the concert goer to listen to the symphony once a month is not at risk. But you are by nature of the amount of exposure adding up. Uh, until we can regrow the hair fibers, if they have reached death, if they are done and they're gone, and it's like stomping on the grass. So
Okay.
you can stomp on the grass might
Still
spring
comes
back up,
back.
but if we keep stomping on it, at some point you've got holes in your yard. There's
Yeah.
holes in the grass. Yeah.
Absolutely.
Yeah.
That's really good analogy. Do musicians process sound differently than non-musicians? Are
They
there any?
absolute oh
Yeah.
yeah. The neuroscience of musicians is really, really fascinating, and there's not consensus on how much of a musician's brain difference is nature versus nurture, which I think is also really interesting. I think that there obviously are people who have a strong propensity and skill and what we would call talent toward music, uh, and then you have years and years of intense study building on that skill as well. And so they have examined the brains of musicians backwards and forwards and found that they are hyper attuned to subtle changes in pitch that the rest of us aren't, hyper attuned to subtle differences in loudness that we are not. In fact, I tried to be part of a study in undergrad and was not allowed to be a participant because I had too much musical training. So y'all skew the results, and we skew the results because it's too good and isn't necessarily performative of an average person's ability to detect those things. And so whether that's someone was born with a superior ability to do that, it's possibly, but also it develops over time and skill. And I think about things like I'm a vocalist. Obviously, we all know some people who are born tone deaf, and we know people with perfect pitch. So there's going to be a spectrum of people of intonation in the middle there, but it's both. And the brain isn't fascinating.
So that actually always fascinated me, tone deaf versus perfect pitch. Is there a physical explanation or professional explanation from the side of audiology or neurology? Um, what is that in the hearing system apparatus that creates tone deafness and
Oh,
perfect pitch? I know
I'm gonna
it's not
have
a question.
I don't know. I don't know the answer to it, but it's not a hearing issue. It's really
Okay.
not. Not from a can I detect the sound? Do I have normal hearing thresholds? The people can hear the pitch. They just can't differentiate between the two of them, right? It's I think it's going to be much
More
more
like a
from the
cortex.
auditory, yeah, from the cortex itself, but I have not studied that individually, so
Okay.
I don't know, but I think it is fascinating because
Yeah.
yeah, when I hear a pitch, I can't imagine just not knowing what it is. But obviously, I kind of want to use another analogy about languages. So obviously, music is not language, but I think that there's a lot to learn about how the brain learns language and processes language that could be applied to musical technicality as well, in that at birth, a baby is ready to hear and know all languages. They have the capacity to know any of the world's languages, but through even in utero, they are already being exposed to their native language, and very quickly the brain's going to start pruning out neural fibers that are not relevant to that native language, which is why, myself at almost 40 has no hope of ever being fluent in Chinese. Like, it's never going to happen for me. Those neural pruning has happened because I don't even have the capacity anymore to hear the difference between she, and she. It's all the same. Was that because I I needed to be born and be exposed to those types of things. And so musicians too, especially if they started at early age, their brain was all in tune, 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 prune, prune, prune. Let's focus on this extraordinary ability to make small detections of sound and pitch differences, and it all adds up over time.
In a certain areas, that's really nice. I didn't know that the brain prunes as we go along. That
Well,
explains a
there's
lot of
there's
things.
critical windows where we really, if you're going to learn a second language, you need to do it before the age of 12. It doesn't mean the brain isn't plastic, and there's great science to show that we should continue to challenge our brains and pick up a new instrument even in older age and all those things, but it's a lot harder.
Absolutely, absolutely, great. Many musicians, especially wind players, spend thousands of hours immersed in sound. From your perspective as an audiologist, what are the most critical things musicians should understand about their hearing health?
Yeah, your ear is your most important instrument. It's your livelihood. It's it's worth protecting. By the time someone is aware that they have a hearing loss, and by the time that it's impacting communication, you've already had a hearing loss for 10 years. So I think that if you're waiting to be able to detect it in yourself, you're going to miss the boat. We're generally garbage at assessing our own hearing and knowing what's going on. So being really proactive about understanding your hearing, protecting your hearing. And I was looking up some different numbers and stats on clarinets. Clarinets are in the top 5 of loudest instruments,
Is
which
it
actually
really?
it really is. We give brass players a hard time because it's so obvious that
Absolutely.
they're so loud. Clarinets are right there at the top.
Wow.
And so, yeah, it behooves you to be as protective as the trumpet players, because of the capacity of that instrument to resonate. And
Absolutely.
so taking care of it early and being proactive is going to be really important, because I can't regrow the hair fibers for you. I wish I could. I wish I could.
There's no laser implant invented yet.
So In the last year, there have been there has been progress in gene therapy where when we can find out exactly the genetic code that went wrong to cause a hearing loss, they're hacking viruses, they're putting in gene therapy in these children born deaf, and we are seeing regrowth of hair fibers for the first time. And I've never seen it, and it's
Amazing.
brand new, and it's $1 million per child. So it's very early. It's very early days,
Absolutely.
but it's going to take a while before that applies to the rest of us.
Yeah.
It prevention is, what is it? There's a phrase, prevention is worth a pound of cure or something. Anyway, you got to
Yeah.
just protect it early on.
And we'll talk about prevention and methods of that a little bit later. Um, Before that, I'd like to ask another question. How does prolonged exposure to high decibels or decibel levels, such as rehearsals, especially in orchestras or in a tight spaces, affect auditory health over time? Um,
Yeah. When we think about noise-induced hearing loss, it actually shows up in a really specific way on the auditory system, regardless of the original source of the noise. So people often think if I'm exposed to a loud sound, I'm not going to make up a number, at 2000 hertz, I'm going to have a hearing loss at 2000 hertz. And it isn't a one-to-one correlation like that. It would, regardless of the noise, whether it's me attending a NASCAR race or my hunting rifle or my very loud clarinet,
yeah,
noise damages a very specific zone of that cochlea. So you remember those piano keys.
yeah.
Um, the ones that are tuned between 3 and 6,000 hertz are the ones that fall first when we've been exposed to noise. So this is obviously very treble. In speech, those are some of our consonants like F, TH, SH, sh, s, very high
Very
pitched
interesting.
consonants. And so when we lose those particular sounds first, we start losing clarity of sound, not loudness. And I see it on the audiogram. So when I test someone, I plot a graph of their responses, and we call it the noise notch because it's so predictable where they hear, don't hear at 4,000, and then it recovers.
Hmm.
So and looking
Interesting.
also at the sort of the spectral uh, capacity of clarinets, like 4,000 is pretty important for y'all. It's gonna
So
be a key one.
what auditory feedback would, or what auditory things would fall between 3,000 and 6,000 hertz?
Are you mean like what other sounds in the environment,
Yes.
or well, birds? I mean, we talked about certain bird songs, which are often very treble. It's going to be the ding of your microwave, the turn signal of your car, soft, high pitch alarms and sounds. And it may not even be that you don't hear those sounds at all, but you need to be closer to the source to pick them up. So, oh, I used to be able to hear the microwave ding from 2 rooms away, and now I need to be in the same room, like that kind of a thing.
Okay. Very interesting.
Mm-hmm.
Um, so my next question would be, musicians rely heavily on subtle auditory cues for tone, pitch, and dynamic controls. And can you explain how auditory feedback loops work in the brain and how hearing loss might affect this ability to self-regulate their
Yeah.
tones or what they do?
Yeah, so if someone is starting to have a hearing loss, their biofeedback mechanism is going to be off because they're going to need the sound to be louder in those damaged regions in order to detect it, in order to pick it up. So there's the potential that for someone who is not hearing regions of sound well to actually start compensating their own instrument in order for it to sound balanced again. So if I'm not hearing certain frequency range well, I go, that seems kind of soft. I should play louder. But
Yeah.
should you? Should you be playing louder? Because maybe not. Maybe we're actually losing some of, and it's not even just my instrument. I need to play in tune and together with everybody else. And so that's the risk. I think that's the fear that people will have is I will lose my ability to regulate my own sound and what I need to do to be able to keep my pitch. And it isn't just loudness, it's back to clarity. And so at a certain level of hearing loss, these hair fibers maybe are still responding to sound that gets to them, but what they're sending up through the auditory nerve is distorted. And distorted sound will really get you in trouble too. It's like having an electrical signal with noise in it, where the sound gets through, but it's not a pure sound anymore. It's a splatty sound. I'm thinking about words that people have used with me, but they'll describe it as just not sounding as pure, that it sounds like a stereo system, a radio frequency not on the right dial, or like an overdriven speaker, because that the
Yeah.
cochlea is
Yeah.
our speaker.
It is. It
and
is.
and and we can crank the volume up, but everything has to pass through that broken speaker in order for the auditory cortex to even translate it. So um, when we start seeing higher levels of auditory distortion, it's really difficult.
And louder sound doesn't translate to more clarity, right?
Not at a certain point. The hair fibers have to be there. If they're not there, who's receiving them? Yeah.
Absolutely. So,
I,
what is
I
the
can I use an example? Can I give a patient
absolutely?
example? So a gentleman came to me a few years ago, a professional musician who now had hearing loss and pretty terrible tinnitus, and it was a very emotional experience because he was worried that he was going to need to give up music entirely. He was worried about exacerbating the tinnitus, and really tinnitus deserves an entire podcast unto itself. So I don't want to get too much into it, but once we treated his hearing loss and he got hearing aids and we really focused on the type of sound that he needed for music, he actually went back and re-recorded some of his more recent work because he was sure that the sound balance was a little bit off. He goes, I wasn't hearing so much of that high frequency region until I got my hearing aids that I was audio mixing my own sound
Hmm,
inappropriately. And he went back and redid it.
great. Um, can hearing aids compensate 100% for hearing loss for musicians, or what would you say? It's a tricky
Oh,
question.
that's a complicated question. Um, Hearing aids do not cure hearing loss. They just don't. They are not cure. They're wonderful. They're amazing. They're computers. I have a whole switchboard of pitches that I manipulate at the time that I program a hearing aid for my patient, and I follow a prescription of sound to make sure that they're getting the right amount of sound in the right places. But all of it is compensation. All of it is using the sound, yes, using digital signal processing to clean it up and filter noise and do fancy things, but I'm still at the mercy of those hair fibers. So
Yeah.
it partly depends on the severity of the hearing loss. Treating hearing loss earlier is always better than waiting and waiting and waiting, but protecting the hearing in the first place would be the best of all.
So, what are some of the treatments we can encounter in hearing loss, or prevention or remedy?
And so would you like to then talk about some of the hearing protection options?
We can go there first. Yes.
Yeah, so if we can't control the environment around us, if we can't actually tell all our fellow musicians to play softer, and we can't change the reverberation of the room, which you probably can't, you probably don't have that kind of control. You can if you're using speakers and amplifiers and things like that, but if it's acoustic sound, it might be what it is. Then you have to rely on protecting yourself at the level of your ears. It's kind of the final resort is to lower the volume of sound as it enters your ear. And that, of course, is done with any different type of earplug, of which there's different models. The sky's the limit, really, in terms of how much money you want to pay for a type of earplugs. But at the end of the day, they're doing the same thing. They are attenuating the loudness, the peak volume, so that it cannot enter your ear, and not to block out sound altogether. Musicians don't want that. You don't need that. You still got to hear. Still got to hear. But we're trying to shift it down just low enough that it's no longer in that harmful range.
Yeah. So when I was in orchestra, we had these very cheap, spongy earplugs, and they blocked out a lot. They were effective blocking out high sound or loud sound,
Mhm.
but they blocked out a lot, and I wasn't sure sometimes if I hear the orchestra quite well. After that, I bought a really nice earplug that was a umbrella shaped earplug with three umbrellas. on
Mhm.
them,
Mhm.
and that really worked good for me. I heard everything, whether it's
Good.
a high pitch, low pitch sound, whether it's a mid level, high level sound, but not over the top, so it would not.
Mhm.
Um, um, well, it would protect my ear from those issues. So, what are some of the things musicians can encounter? What are the advantages or disadvantages you might point out in a general sense?
Yeah, and I want to make this statement. The best earplug is the one you're willing to wear. Like, regardless of some of the like spec differences and their design this way or the other, at the end of the day, the earplug that gets the job done, that is comfortable to wear, that you actually brought with you to practice, that you can wear for, extended period of time, that's the best earplug. And I'm very pleased that you know to use them. So I just want to say that first. Like, the best earplug's the one you're willing to wear. If they're uncomfortable, if they're a hassle, if you can't find them, it doesn't matter. It doesn't matter how much money you put into it. And I'm glad you brought up the sort of most over the counter version are the foamies, right? The
Yeah,
foamies are the worst for musicians because of what you described. They spectrally are not equal. They block out too much a lot of the times, and musicians really need to be focusing on filtered earplugs, and some of which are still over the counter, like you described, and others are custom fit. But all of them have a filter that is still allowing sound through, but in a far more flat response. And that way you can trust that you're getting the right balance of those bass and treble sounds in order to do what you need to do. And what's also nice is that about filters come in different strengths, different decibels of attenuation, and that's going to be dependent on your particular environment. Are you in a rock band, or are you in a symphonic band, or is this just a quartet? In a quieter space, you may not need that maximum level of filtering in all conditions. Some of the earplugs even have removable filters where you could swap them out, and I like that a lot because I think it gives you some flexibility.
absolutely. I don't know about those yet. And you can buy them over the counter too. Those replaceable
Yeah,
filter earplugs. Okay.
many of them do. Now, I do want to talk about custom filtered earplugs. Those are the ones that I work with and provide for my patients who come to me, because for extended use, if you're going to be wearing them for really hours on end, it may behoove you to go ahead and spend a little bit extra and have them custom made for your ear. Because certain ears are twisty turny, certain ear canals are very small, certain ear canals bend and shape, and there's no wrong. Ears just do things. They don't go straight into our head. So if you've tried the over the counter ones and they just don't fit quite right, they don't get in deep as they really need to be, you're probably going to need to make a custom option. And that's where a provider helps you with that. So I fill the person's ear with putty,
Yeah.
the putty cures, and now I have a negative impression of their unique ear. The mold is then made after that impression, and they fit the filter inside. And a lot of those ones have the removable filters, where at the time that we order it, we could also order like a second set of either upper or lower of the decibel of the filtering. But now they've been shaped and made specifically for your ears.
This is a well related, non-related question. Would insurance companies cover some of these custom-made earplugs, or is that really something that they don't generally do?
I have never seen them covered by health insurance.
Okay.
Audiology has horrific coverage when it comes to health insurance. The exam, a hearing exam, is probably covered. I can tell you the status of your hearing, but treatment that does not require surgery is very often excluded. That includes hearing aids. Hearing aids aren't covered either. So I have never
Okay.
seen earplugs covered. So maybe there's some negotiation with your employer, your union, or something else, guild to try to finance them, but from a workers' comp or kind of situation. But I have never seen insurance cover them.
Okay. Okay. Um, when we talk about hearing earplugs and then filtered versus non-filtered, obviously there are earplugs, earphones that we might be able to hear music through, and you can see those that you don't plug into the ear, but it connects to um, the bone of the skull. What can you say about those earphones versus those that you actually plug into the ear canal.
And so you're referring now to just personal listening, not ear protection, but just how I'm
Absolutely.
listening. I'm listening. I'm listening to this podcast, and how is the sound coming into my ears in terms of headphones? Um, I I don't think that there's any greater risk factor with one or the other. Uh, the bone conduction headphones can be popular because it does keep your natural hearing open. You're not occluding. Sometimes there can be a little bit of a tunnely sort of I'm closed off from the rest of the world effect if you're wearing any type of headphone that is in or over the ear. So people sometimes like the more open concept of it. But we're back to this kind of the same noise formula. You can still damage your hearing by overdriving any type of headphone for too long. So whether the sound has passed through air, the eardrum, I mean, that whole pathway that we looked at the beginning, passed through air, or we skipped the ear canal, skipped the middle ear, and just drove the sound directly to the cochlea, the sound is still being picked up by the cochlea. So the hair fibers are still hearing it no matter which way it got to them, and we have the potential to overdrive them in any case. So I think that when people are at risk of hurting their own hearing through personal listening devices, it's because they have the volume too loud, especially if you're listening in a noisy place. You have to then increase the volume to hear over the acoustic noise around you, but it's the absolute sound level of the sound that is damaging to you, not the sensation level, which is the difference, if that makes sense. So my
Yes,
noise floor,
absolutely.
let's say, is 50, the decibel of my headphones are 90. Like, just because you're perceiving it at 40 doesn't mean it isn't still 90. So that still holds.
Okay.
And my rule of is, well, how do I know if it's too loud? You can set the like warnings on your phone and your watch that says this decibel's too loud. I like that. You also, if you cannot carry a conversation with another person at the same time that you're listening, it's probably too loud. If you're like, what? Huh? Let me turn this off. And now I have to talk to you, it probably was too loud.
Okay. Nice
Just as a
gauge.
way
Yeah.
of gauging. Yeah. Yeah.
Absolutely. I was gonna have another question based on your client had a hearing loss, and try to overcompensate for his own playing and volume. If a person has a hearing loss, let's say, and sits in an orchestra, would that person perceive his own playing differently than people that play around him with because of the hearing loss, or the
It
perception in the ear is that same from coming from me than coming from other people, musicians?
At a certain severity of hearing loss, it's possible. It's possible. I think for early days, for more mild to moderate, probably that person is still leaning back on, well, this is the amount of vocal energy I'm used to applying. So I just sort of know deep in my bones and the of how I should play forte. And I think that there's a lot of muscle memory in that regard that people will lean back on as with your experience. But the more the hearing loss, the more you really can't rely on those cues, and that is where it gets tricky. And the example that I see in the clinic is at a certain severity, people start talking too loud, and they don't know they're talking too loud. They just are compensating. And maybe their friends and family, like, do you know that you're talking too loud? And they're like, no, I'm not. But that's more severe hearing loss. But earlier in days, I think people are going to probably hold the line because of that muscle memory. But at a certain point, you start to compensate in all sorts of ways, whether you know you're doing it or not. It's so gradual.
Absolutely. Nice. So what can musicians do who have hearing loss already, or maybe, or tinnitus?
Yeah, that's a complex question, and obviously you need. I mean, everyone should be getting really good baseline testing every few years. If you've never had a hearing test, you should go be tested. If you do not have hearing loss, I would be tested every 3 years. If you do have hearing loss, probably closer to every two, just to really be keeping an eye on possible changes in the auditory system. Musicians can absolutely wear hearing aids. I would want to go to an audiologist who has special skill in modifying sound for musicians, because hearing aids, as a general rule, are prioritizing speech. And some of the digital signal processing features that we apply to speech and we apply to noise filtering are the exact opposite of what we want for music. So the vocal tract is fairly constricted in its capacity for volume and the types of frequencies of the human voice, even across men and women. It's a fairly predicted and bracketed type of experience of the sound that a voice can make. And hearing aids in generally are trying to improve communication. And so that's has one set of goals. But music, oh my goodness, music, the dynamic range of music from very soft into far louder than the human voice can go, and then the frequency spectrum of all the instruments together from much more bass to much more treble. That's the challenge, is just that music is an entirely different type of signal. And so when I work with my musicians, I'm already planning for them. We're going to need to create a distinct program for them just for music that is not for speech. Um, and when people can bring me the instruments into the clinic and they play in real time while we're modifying, it's the best of all if they're able to do that, so that we can customize it for them. But get tested. You got to have the knowledge so that you know what's going on. You still need to wear hearing protection so that we're not causing any of those hair fibers that are holding on for dear life to further fall down. And then we treat the communication needs as they come.
Nice, thank you very much. Now, I'd like to ask a couple of questions about educators who work with musicians, or they might be music educators. What role should they be played? So, conductors, ensemble directors, in promoting hearing health among musicians.
Yeah, and as an educator myself, I'm so glad that you're bringing this up, because I think that certainly more could be done. I do think that awareness of noise-induced hearing loss is growing and growing just across the population. I think awareness of hearing loss is growing across society. It They call it the invisible disability because it's not talked about. We wait and wait and wait to treat it. We just sort of assume that's only for old people, like all these different things. The stigma of it is not helping public health. And so getting your musicians and your students educated early on about how they can be proactive, of how they can protect their hearing early, is super important. If they don't have the knowledge, they don't know. And like I said, by the time you think you have a hearing loss, you've probably already had it for 10 years. So we need to be far more proactive about it, from high school band to performance many years later. And I think that the most experienced musicians certainly could lead by example. Look, it's cool to wear earplugs. I've got them. Here they are. This is where I got them, so that the younger professionals are seeing that and like, oh, everybody here has them. I should probably, little peer pressure never hurt anybody. We probably need to incentivize the use of earplugs, not just, hey, just so you know, go buy some earplugs. Like, can we incentivize it? Like, if you wear them, you get, I don't know, I mean, make up some kind of prize or something to encourage people to do it. And this types of motivational encouragement comes up in all sorts of other occupations where we need to protect people's hearing. You got to make it easy to use. Can you give people coupons to get them more cheaply? Can we incentivize the use? If those things are not in place, and also they see, well, my manager never wears his earplugs, they're not going to wear their earplugs. They're just not. We're human beings, and we have to sort of collectively have a culture where we protect our hearing because we care about you, and we care about your current performance, but also your entire career and what that impact is going to look like.
Now, two preventative methods I've seen in orchestras. One is when they when they screw a huge transparent plastic bottle or bowl on the side of the wall at the entrance of the orchestra rehearsal room, and they fill it with these spongy earplugs. That's definitely one I've seen. And another one is when on tripod stands or any other kind of stands, musicians have, at least in the wind section, they have these transparent panels behind them so that they actually don't get the sound overblown from behind. So these are the two that I've seen before.
Yeah, I like that type of acoustic control, like the panels, because the more that you can adjust the space, you're protecting everybody, not just who's wearing their earplugs or not. Like that puts all the burden on the individual when there might be some collective choices that would help everybody.
Yeah.
Yeah, that's great.
Um, do you find that musicians are more attuned to early signs of hearing change compared to the general population?
No.
Okay.
I have no data to support that other than just my clinical experience. I've said this earlier, we're all just really bad at it. We are there's just so much misunderstanding about hearing loss, about what causes it, about it's painless. There's no pain involved with hearing loss. And because it happens so gradually, so slowly over time, you often are not aware until it's a really big change. So as much as I praised the brain of the musician earlier, I have not generally found them to be superior necessarily about detecting their own hearing loss.
Okay. Fair enough. Um, the next question would be if you could offer one piece of advice to every clarinetist or performing musicians about hearing, what would it be?
Yeah, for Christmas, ask for a pair of custom filtered musician's earplugs. You can get them with like purple sparkles in them and make them really flashy. And you should get your hearing tested if you never have. So we test at birth, we screen for hearing loss. We test in grade school, and then we never test again. We just completely ignore this part of our body. Even as we test our blood sugar and our weight and everything else, we just ignore our ears. And your ears are your most important instrument. And so if you've never had a comprehensive hearing test, start there. Have that first data point that you can now compare to over time, and so that an audiologist like myself can start to counsel you about ways to protect yourself.
Cool. Thank you. What excites you most about the future intersection of audiology and the performing arts, if there's any?
I think because, as I said this earlier, as society is starting to pay more attention to hearing and some of the long-term impacts of hearing loss on public health, on wellness, all of that is going to ideally result in less noise-induced hearing loss. Like all noise-induced hearing loss is preventable. And I think that certain industries, people just sort of accept it as cost of doing business. This is my job, so I'm going to have hearing loss at the end is really not fair. You wouldn't you wouldn't slowly whittle away the like tips of your fingers. You wouldn't slowly, remove part of your eyeball over time and be like, cost of doing business, I have half an eye. But we
Yeah.
do that to our ears, because we can't feel it, because we can't see it. And so I'm excited that, I mean, even things like TikTok videos about hearing, I'm just seeing more and more discussion about it. And all of that is exciting. And also technology. So I teach courses on hearing aid technology. Our ability to process music more cleanly, to modify music in a true way. They're still digital versus analog, but anyway, that I think is just getting better and better too.
Okay. Would you say that because you mentioned general population in one of your comment, and the exposure we experience, would you say that by the passing of time and with the advancement of technology, that we are exposed to higher levels of decibels or more sound or more intense sound nowadays than, let's say, 20, 30, 40 years ago?
That's an interesting question. I don't think so. But pre-industrial revolution to now, certainly, like humans are capable of far more noise with our gas-powered cars and machines and everything that's around us, and factories, everything in urban noise. We forget to just even riding the subway could be harmful to you. We're certainly exposed to significantly more noise than we were 200 years ago. And Western society, industrialized society, is certainly exposed to more noise overall. But in terms of trend lines of the last 10 to 20, not necessarily, partly because OSHA protections of workers is being enforced, or at least, or if there's funding for it, will be enforcing protections of workers in ways that we didn't see 50 years ago. So we're seeing rates of occupational noise go down because of other types of regulations that are happening in other industries, not just for musicians.
Okay. Thank you very much. I think we can conclude the discussion here, and I'm grateful that we could talk about hearing protection for clarinetists and in general, and grateful to have you here, Dr.
Thank
Patricia
you.
Johnson.